Hi, I'm Russel McKenna with YADAYADA. Have you ever been going to bed and your child all of a sudden makes a noise? Arp, arp, arp. So, if you've heard that noise, usually about 11 o'clock at night, right as you're drifting off to sleep, odds are your child is in the process of having a CROUP moment, or your child has CROUP. What does that mean? Well, when children are young, usually there's a peak age about in their early toddler age to 5 or 6 years of life. So if your child experiences that sill bark cough and you go down there, likely you'll see a child that is one of two things: either resting very comfortably and sounding very horrible, or they're going to be sitting up going and they might be leaning forward and having a hard time catching their breath. So what do? Well, cold night air can be a good thing. Sometimes turning your shower on and shutting the door in the bathroom and steaming up the air, that can help settle down some of the symptoms. What if that doesn't work? Well, if your child has mild to moderate symptoms and if they're old enough to talk and they can't talk in complete sentences, you might want to start heading towards the emergency room. And what I've told some of my parents is when you're heading towards the emergency room, just crack the window in the car, see if that cold night air will calm down the barking noise, calm down the stridorous sounds, and by the time you get to the emergency room, if that works, hey, maybe you dodged an ER visit. If it doesn't, then you will likely go into the emergency room and they may give your child a breathing treatment with a medicine called racemic epinephrine, which helps to decrease the swelling below the vocal cords, which is the cause of croup. And they will also give them a dose of an oral steroid. The steroid takes about 4 hours to kick in, so they might watch your child for a time. Now, what causes croup? Well, usually it's a virus. And there are many viruses that can cause croup. About 70% of the time, it is caused from a virus called parainfluenza. Now, if your child has parainfluenza, they usually won't have a fever with this. If your child does have a fever and they have croup, get their ears looked at. Maybe they'll have an ear infection. If they're old enough to tell you their ear hurts, I'd get their ear looked at. If they don't have an ear infection and they have a fever, then it's likely that you're probably going to witness some diarrhea in the next few days, or you witnessed it prior to that illness, because there are some other viruses that cause croup that can give those symptoms. So what if it's summertime or you live in a place where you never experience cold weather? You could open up the freezer door, or if you have a deep freeze, and just sit there and let them breathe in that cold air. And that may help lessen symptoms. Another question with croup is, how long is my child contagious? Now, it depends on what virus they get croup from, and most of the time you won't know what virus that is, but usually within the first 3 or 4 days after the onset of the barking sill cough, they're less and less contagious. You probably still want to remind them not to swap spit with everybody and keep them away from other children for that 3 to 4 day window. So one other crazy thing with croup is it's always worse at night and it goes away in the morning and you think you're out of the woods, but then that night you get the same art and the same distressful and you're like, dang it, I should have taken them in. But just know that if it's mild symptoms and you can do things to help them relax and they can talk to you, they aren't having air hunger, then you likely will have 3 or 4 nights like that, and by the 5th night, it'll be all better. If your child has recurrent croup, that can be a sign of bad things, but it also can be something that you just commonly see in children without any underlying problems. And so 2 or 3 times a year, it's not uncommon to have an episode where your child starts barking like a sill. So if that's the case, you'll become an expert and you'll know what to do. When your child wakes up in the middle of the night with a croupy cough and you've tried all these things, don't forget to also do things that help them feel comfortable and calm and to calm them down. So you could get them a sip of water. You could read them a book. You could give them some Tylenol to help with fever or pain. You can hold them, rock them, and if you can get them to be able to talk and to drink and swallow, usually things will subside and they'll be able to rest better throughout the night. Some ask if croup is a wet cough or a dry cough. Usually it's a dry cough at night, and it's a cough that may loosen up during the day. It also, in older children, could just be laryngitis. So if you have kids with a hoarse voice, or you have a hoarse voice, and you have a child barking like a seal, well, you'll know where it came from. Maybe you gave it to him. So when you hear, "Arr, arr, arr," you're going to be an expert. You'll know your child is going to have croup because they'll have it.
So true.
And because they have it, you don't know what to do about it. No.